Welcome back to the Above and Beyond Dermatology podcast, where we help you go above and beyond the conventional wisdom of taking care of patients and taking care of business. I'm your host, Dr. Stephen Llewellys. I'm a Stanford and NYU trained board-certified dermatologist with a passion for integrative dermatology and business development. I'm also a recovering cog in the wheel of big healthcare, and I'm the owner of Above and Beyond Dermatology. I'm also the medical director of Skinovations Medical Aesthetics. I'm building this thing in real time, and my goal is to help anyone out there who might either just have an itch or be well on their way to doing something similar. I want to try to bring you some value along the way as I'm learning and applying it. If you're a regular listener to the show or have ever listened to any episodes prior to episode 40, you likely know this show as the Direct Care Derm. I'm moving on from that title as the show has certainly evolved over time, but as I discussed in a previous episode, it'll be Above and Beyond Dermatology from here on out. That title much better encompasses what I'm trying to do here. It also aligns with my brand and everything I'm trying to do in terms of building my own practice, as well as helping other people who are wanting to do something similar. I'll gradually phase out this introduction as the new title becomes more familiar, but I did want to address it to avoid any confusion. Thanks for being here and enjoy the show.
Welcome. This is Dr. Steve Llewellys and owner in dermatology. I'm your host on Dermatology Podcast. Welcome to a very special episode. Actually filming live from, not live, it's live for us from the Newmedical Technology headquarters in Illinois. Really grateful and glad to be here. Who is the director of marketing for Newmedical Technology. And you may or may not have heard of Newmedical Technology. If you're a patient of mine, you very likely heard of Silagen, which is that we're going to be exploring. But without further ado, thank you so much for being here. First of all, thank you to all the technology team that is gracious. If you look on my business card, one of the core values right across the bottom is hospitality. And I think that since walking the door here, that's the main choose company. Put my trust in, I try and trust. Thank you for being here, and we're here your story.
Thanks for having me.
So I would like to start with your story, how you came to either Newmedical or to Silagen, or what is the little spark to this? Clearly, you're passionate. Everyone here is passionate about products, and it's not just Silagen. We're going to be back as far as you want. Story and
Many years. So I always say that it's serendipitous that I work with Scar products because back in 2000, I think 2001, I had thyroid surgery and I had a goiter, a large lump in my neck. And they kept telling me, we need to take it out. We need to take it out. And I had young children at the time. I had this idea, can you go anywhere else besides right here? They said no. And I'm like, we'll schedule that after Christmas. We'll schedule that after the summer. Well, and I kept putting it off and off 100% because of the scar. I'm not afraid of surgery. I'm not afraid. I was fairly certain it was not a cancerous problem. It was just a goiter. But I didn't want that scar. I didn't want my kids to be afraid of me. It got so bad to the point that my goiter would go below my collarbone and stuck. So it was bad. And so finally they said, you've got to do this. It was constricting my esophagus, all kinds of stuff. So finally I went in, I had this surgery, and it was at a teaching hospital. And my ear, nose, and throat doctor, who was my surgeon, as they are wheeling me into the OR, they've got the Versant on board. I'm going, where is he? You're closing. You're prying me. You're doing the closing, because I wanted someone fully very skilled to be doing that final incision. They did a running sub-Q, and when I woke up, I had steri strips stacked all the way across. Killed me because I had to leave them on. I just wanted to see what that looked like so bad. But I was fortunate. This was before I had worked with any of the scar companies. This is when Mederma just launched and nobody knew what it was. You just didn't hear about scar treatments back then. And fast forward to, I will say, and it's funny that I have a turtleneck on today, My son will sometimes say to me, do you remember when you used to, after you had your surgery, you wore all turtlenecks and you had scarves around your neck all the time? But I was self-conscious of it. I didn't want to be Frank and Mommy. I didn't want my kids to be, especially him, he was little, to be afraid of me or to be embarrassed by me when I'm with their friends. So I was very fortunate. I healed very well. He was able to put it in a crease in my neck, but I 110% get concern over scarring. And I'm so vain when it's on your face. I was professional in sales at the time. When it's on your face, it's on your neck. It's a big deal. And so in 2006, I had the opportunity to start working for a company that manufactured a silicone scar gel. And everybody in my family was like, oh my God, this is you all the way. This is perfect. And so I started with that company in 2006, and I was there until about 2013. And Mike hunted me down, my boss hunted me down on LinkedIn and found me and asked me to come join Newmedical because they were just in the process of launching their Silagen. And I walked the Silagen brand, and I walked in the front door and he said, we have a name, Silagen, go. And we built the products from our very first Silagen Pure products. These are like my baby in a way, but we literally packaging to messaging, everything. It was started with this. We do a lot with aesthetics, especially in plastic surgery, but the really meaningful ones are the ones where we're able to help somebody who has had breast reconstruction, has had a tragic accident, has burned, has a Mohs surgery that is just this huge scar on their face, and these types of things. It's so rewarding to have a product that can help these kinds of people, and very trustworthy. Silagen was launched in 2014, the fall of 2014, and we are the largest physician dispensed scar products in the country.
It's a tremendous introduction. Good job by you for taking the ball around. It's a testament to your leadership.
It does.
Working with and collaborating. Bigger, more a little bit away from that, but if the culture is right, you can or change it. Just regular families change over time. So, this very real. I talk freedom or apologize for this. My he doesn't have to work. It's just especially if there's a way dress or improve. We should be proactive. And the point that I took away from your story as doctors, better at not making assumptions on our experience on the other side before consulting, whatever it is, patient's most concerned or scared. That usually it's going to just with ask, why did you actually get so counter? And I just visited. What are you?
And I also think that there's some of it, patients put doctors somewhat on a pedestal, and they don't want to feel like if you're questioning their surgical skills, if you question, am I going to have a bad scar? And there was actually a clinical study that was published in one of the plastic surgery journals where they actually asked patients who had plastic surgery in the past 24 months or something along those lines. And stats from that were really revealing, where the majority of patients felt that they were more concerned about their scar than their physician was, than their surgeon was. And when I talk to doctors, sometimes I think that they think the patients are expecting a miracle, that it's going to disappear. And the results from that survey showed that people were happy to do anything they could, even if it resulted in just a small improvement in their scars. And if it was on a visible area like their face, it was 90-some% said, yes, be something that I could do to help with this. So I think there is a little bit of a misconnection or miscommunication there sometimes. Part of it, I think, is a hesitancy on the part of the patient to say, but also doctors are cutting all day, every day for weeks and months and years. So it's routine to them, but it's not. Hey, this may be like when I had my thyroid surgery. That's the first surgery I had ever had. So the whole thing was scary. I had nothing to base it on.
doctors here together is just to start and understand that this word collaborative prejudging your surgical right? Actually, that kind of stuff, just me as a dermatologist, do some procedure. Managing, that's people do not them without it. It was told me what I can for it. That is a dermatologist. I should.
Soft touch.
Enter or just action child who might be in the room or they care son or all of that stuff. But also this kind. I talk about probably on the other end of that spectrum and it's as bad. I'm 105 sometimes, and that's patients who are looking at the watch and they're like, "Our doc, I could go somewhere. Is this ever going to end?" So there is a balance for everyone. You can move away in your practice from, say, go Silagen Scar, maybe who knows? Just go find this. Sit down a little bit more, just one time. For whatever search. Assuming that they just we do a great job because
many years ago, I worked for a consumer product company, and we had products that are available at Target or Walmart or wherever, and we had lotions and cleansers and all of this. And I was going into dermatologist's office, and I was shocked that dermatologists had like baskets full of Dove soap in their waiting room, or Olay. Back then, Olay was the first one that had the moisturizer with the sunscreen in it. And all of this stuff, I'm thinking, oh, this, I was used to like pharmaceutical kind of stuff. What somebody explained to me is that what the patient cleanses their face with, what the products that they're using on a daily basis can impact what the doctor is trying to achieve with the medical products. So rather than saying, wash your face with gentle soap, I recommend this soap and this moisturizer is not going to cause irritation and is not going to conflict with that. And I think it's the same thing with the scar products. You always hear about your grandmother's hairdresser's niece's roommate use something for their scar and they loved it. But to me, if I'm a doctor and you're just like sending the patient out into the wild and saying, yeah, go get something. And we've learned from experience that there are counterfeit products on Amazon. You don't know what you're getting. So I think by handing the appropriate products to your patient, they're going to get a better outcome. It's not going to negatively impact what they're trying to do. I think they appreciate it. They take that more seriously. They're more likely to comply with it.
That's education to also sales and marketing are combined to one. As a doctor is teacher. That is what we used to, what many of us still try to be. The system has gone certain over the last few decades. It's harder to teach for 10 minutes, especially with someone who has a really distressing. We don't generally. You just have a thought in your arm, so that point is fine. Your hair is falling out. Okay, also, it's a struggle. It's a systems issue more doctor problem. Myself, and in practice, it's my job to do a better job. Of course, we talk these types of products. Colleague Thomas, thank you, colleague. Off camera right now, but for chance on me putting all this together, going to your team, they were going to do headquarters. When I first proposed this, do you know anyone at your company who might want to do a Zoom call to record a presentation? That was their request, and that it turned this because Michelle, originally going through residence, I was just talking to Kurt before about how can we reach people earlier in their careers, have residents do a better job, their scars, because the resident have more time. Oftentimes, like in practice, good way, nurse practitioners, physicians, patient up in those interactions.
I think it goes even beyond that. I think some of the general staff putting the patients in and out of the rooms. The patient may not say anything to you because, again, you're the doctor, but the MA comes in or the nurse comes in and they're like, should this look like it does? They wouldn't ask you that, but they ask them. And so I think that having everybody be aware of the options that are available and what can be done, and it can be just such a comforting factor for the patient to be actually doing something. We used to joke that happy hands are, they want to be doing something. Me with my steri strips going, looking and trying to see what's going on there.
And that's empowering. Everyone at the reception, everyone could get something that would measure correctly, applying it appropriate. The culture of the doctor, you scared or worried to, and that's all you were not judging it for your possible outcome because doctors get that. I practice it, my job. I feel like, no, could my health all or my hormones, something is wrong.
I don't want to sound like a hypochondriac.
And that patient has dismissed by doctor after doctor, and they were go basis, just not true. At leader, primary creator of the culture, base that more pots and more patient they're going to get.
And to the credit of doctors, I will say, since I've been doing this for 19 years now, when I first started back in 2006, we would go to a medical convention, a doctor's convention, especially with the plastic surgeons, and you would have a scar product and they would say, I don't make scars. My patients get scars. I'd look at them like, okay, you know what I mean? Maybe your scars look good, but you're still making scars. But I think at that point, they were afraid to say, hey, I do a good job, but this might help even more. So it was an ego thing, or if I give a patient a scar product, am I saying I'm not real confident in my abilities as a surgeon? Here, take this just in case. And I will say that kind of mentality has changed. The whole preventing the scar message has definitely gotten through, and people are understanding that it's part of the package of care. It doesn't end at the ORs. There's an expectation now. So many doctors are doing this that they want. It's almost a peer pressure thing in a way. What are you going to do for my scar? But I think that doctors have come around to understand that they can recommend a scar product without the patient thinking less of their abilities.
Actually,
they care.
They thought extra. They had this surgery about this thing. Make it convenient to purchase it. It's like that. Silagen. So can you talk a little bit about that, because that can be tricky as well. It all goes back to
right.
And my job at the time to myself, how can't be too many words, decrease friction, things like a tech company that jump as frictionless as possible. How can I?
I think there's a couple of things. We were just talking about this in a meeting that we had where it's 2 months before the surgery and patients are all hyped to buy. They want to buy the product. And making the patient understand the timeline that says you're going to have stitches. It's going to week 10 days later, we'll take those out. Then we'll talk about that stuff. Let's just worry about this right now. I've got you covered. We're going to get to that. And so it's not overwhelming. If you send somebody out of the OR with dressings and bandages and scar products and antibiotics and all of this, they're like, I don't know what I'm supposed to do with it. So I think pacing it is good and saying, we've got you. I know a lot of plastic surgeons will put our patient brochures in their consult folders so that it's something that is discussed up front that says, just so you know, we are a Silagen office, we'll provide you, we'll offer you the Silagen at the end of this, but knowing that it's coming, it's going to be taken care of, I think is good. And I think we have a lot of before and after photos show the difference between, we have some before and after photos that show a scar that was actually a pretty good scar, but when it's been treated, it looks so much better. Not only is it going to prevent the worst case scenario, like a hypertrophic scar or a keloid, but it can actually make these relatively good looking scars even better. Asking the patient, we have this, you use it twice a day. Is this something that you would be interested in? And a lot of people, I think it will answer an unasked need that they would want. Yeah.
Friction point that I could see. Someone is already on so many things. It's hard to get through. So that's where we just I don't want to know it. I still more medical top. I'm doing a lot of shape biopsies, a lot of lab. Just going back to your point, it's all time, so it's trivial, not trivial person.
Oh yeah.
So, but I also get to do overwhelming day. Script shit, but my system, this patient, whatever, consented. There, on video, tell get. We'll talk. Silicone in general, it works. Those on don't have once refined over time. That patient is here.
See, doctors have asked, I may stand with your brochures in every exam room. So it's always right there. And I remember some people designate the checkout person. When somebody comes out after this, please mention this. So yeah, there's a lot of different ways that we've seen it, that we've seen the offices interact with the product. And how do I remember? And you're right. A lot of the doctors, there's so many things going on. You're dealing with pathology testing and all of this other stuff. And that's why one of the things we will offer doctors is some of these banners like you see here for the office, or we have some posters. I've been in offices where you go into the ladies' room and you close the door and there's a poster for a product on the back of the door. So yeah, there's a lot of different ways to keep that and hopefully get the patient to ask. It's like this, ask us about this. One of the things that we definitely believe in is we launched last year our acne scar product. And there's a lot of patients that are in there for something else, whether it's psoriasis or something else, but they're like, wait a minute, I have acne scars. What do I need to know about this? And that's where having visual things in the office can help with that, because if they don't see something like that, they may not know that there is something that could be beneficial for them.
Great. It's much of a podcast patients, doctors, and this to the show you're here about taking care, and those are the things. Take care of my patient, take care of my staff, take care of it. So this system doesn't matter. Brilliant. This is today, so much diligent. If everyone knows how to do it, that's how your own script version. Still meant to not turn McDonald's franchise. Car sold more or less. So here's check. So we can't crush. But one day, run. Let's check. Invest it. I think our practice, the more revenue stream practice has, the more time if I choose. I can't have on. Care for that. Sure.
Sure.
You don't know silicone generally.
Sure.
So a lot of people know of it. Yeah, silicone for scar.
Or if you're my dad, is that the stuff I use on my bathtub? I'm like, but not. Don't do that. Don't. So silicone has been used for scarring since the 1980s. was more of a medical thing, especially in burn patients, is where they were doing a lot of different things. And what they were came about is with a lot of burn patients, they use a compression garment on them, and they used to use a silicone pad that had perforations in it. And they were finding that the areas where there was no silicone, they were getting like polka dots on it, that the areas with the silicone were actually looking better than the areas where the silicone wasn't touching. And so then they said, can this work on its own? And so they started, and it all started with the silicone sheeting, where a lot of people aren't that familiar with, but this is just a strip where we have a beige version and a clear version where it is just cured silicone that adheres right to it, just like you would put on a Band-Aid. And that's what it was. A lot of it was initially. And so they said, will it work on its own without the compression garment? Because not every patient is that. And they tested it, and there's something to this. And it has evolved into the top gels, which we have now, which are much more user-friendly, depending on the type of scar you have and where it is and your propensity scar. But the silicone gels came out. Up until then, it was more, let's treat bad scars. So it's already become raised, red, lumpy, that looks unattractive. And then we try to fix it. And then the momentum switched to, instead of waiting to fix, wonder if we can stop that from happening to begin with. Could we somehow control the scar maturation process so that we don't get that kind of activity happening? Silicone is one of those things. It's like aspirin in a way. No one's 100% sure how it works, but it works. It parrots the mechanism of action theory, which there's a paper written by Dr. Thomas Musto right here in Chicago, where they think that our bodies are always trying to be in homeostasis, right? If you're hot, you sweat. If you're cold, the hair stands up in your arms and you shiver. Your body is always trying to maintain temperature, glucose, your sugar goes up too high, insulin kicks in. The same thing with our skin, which is our largest organ. If you have a break in the skin, it triggers a whole bunch of signaling that we don't have any idea about underneath, where basically someone's yelling, we've got a break, we got to fix it, send in the supply, send in the whatever we need to fix this. Sometimes that gets a little carried away. And one of the reasons why it gets carried away is that we all know that when you get a cut on your skin, when it first heals, that skin is like kind of pinkish. It's not your full strength skin, closed, very pink and delicate. What happens is that a lot of times too much water is evaporating out of that area. That's one of the things that your body monitors, is this transepidermal water loss. And if the body realizes that there's too much water being evaporated, you get the keratinocytes that signal cytokines to signal fibroblasts to build more collagen, literally plug the hole, send more stuff up. It's leaking. We need to repair the roof. And what happens then is you get this excess of collagen. When you put silicone over it, silicone is great because it is one of the most biocompatible materials out there. They use silicone for catheters and implanted items, from breast implants to chin implants to all of that kind of stuff. And now you see all these baby products now are silicone because to be so with the silicone, you put that on and over it, and it literally like tricks your skin and stops that water evaporation out from that scar. And so nobody's yelling. There's no signaling. So nobody's saying we need more collagen. Just function as normal collagen management. And so you don't get that buildup. So you're literally tricking your skin into thinking that this is fully mature skin. We're going to lay our collagen down in even parallel bundles and all of that. And it's cool that it can work like that because it is completely topical. There's nothing gets absorbed into your skin. It's no more invasive than using a Band-Aid. So that's like where silicone came from. And then once you have the silicone, it's like, how do we make it better? How do we make it more user-friendly? A lot of the earlier silicone gels were very greasy, wet, shiny. You put it on your face, but you have this big shiny spot. And so one of the things our team here, and it's great that we have an R&D team in-house and we manufacture our products in-house. So we have like total quality control. We can make tweaks. We can make the product better and better. And our gels have a very soft, silky feel. It feels like a makeup primer. And so it's matte. It dries matte on the skin. has a very nice feel to it. It's not something that's unpleasant to use and has a texture that a lot of people are used to. Our silicone gels are great. Our sheeting, especially for already formed hypertrophic and keloid scars, the sheeting adds some extra pressure to it. And I mean, I've seen examples of where the sheeting works really well on that. Or even I've seen scar revision surgery where the patient had a keloid removed, looks like the keloid is going to start coming back, and they put the sheeting on it, and all of a sudden arrests that keloid development. So it can do a lot of good things. The other thing that's good with the sheeting is that it has some squishy. It's got some cushioning. So people that have had a C-section, people that have had a tummy tuck, you're wearing clothes, you want to wear jeans. Those scars tend to be, like I always say, zappy. They have like tingly feel, and when you touch them, it's uncomfortable. And so by doing that, putting a strip over it helps cushion it and protect it. You feel like a little bit more secure when you have that on there. The evolution, we started with our pure gel, and which is 100% medical grade silicone. And we came out with and we also had our strips and shapes as well. And we have a huge variety of strips, everything from a 1x3 strip to 2-inch by 24-inch strip for tummy tucks, what have you. We have specific shapes for different breast surgeries. We have dots for punch biopsy and your shape biopsies. So we have a variety of different shapes and sizes with 2 different colors. But then the next step was, one of the biggest enemies of scars is the sun. And almost every doctor will say, stay out of the sun. Protect your scar from the sun. When I had my thyroid surgery, I had one of those big fat sunscreen sticks, and I would be like constantly, yes, as much as I could. And I never got any hyperpigmentation. What we talked about with how that immature skin, it's, if you get exposed to the sun, your body's going to send a lot of melanin there to try and protect that as well. And you can get this hyperpigmented scar that is now brown, and it's another problem that you have to fix. So we wanted to create a scar gel sunscreen that would be used for anything on the face. And if you live in Florida, it could be your hands, your feet, your arms, anywhere, that where frequent sun exposure, even incidental sun exposure, driving to and from work in your car every day, waiting at a bus stop every day, taking the dog for a walk or walking to get the mail or anything like that. It's cumulative. And so the other thing is that we were like, we like the idea that everything stays on the surface, that we're not invasive, we're not getting into bloodstreams, anything like that. So let's do a physical sunscreen, because a physical sunscreen, it's a mineral sunscreen that on the surface works by reflecting the rays away. Chemical sunscreens absorb into the skin. That's why they tell you to wait 20 minutes before you use them. And it absorbs light energy in and turns it to heat. So we said the perfect marriage would be silicone with the physical sunscreen. So we came out with, took a long time, and they will still laugh at me because they would show me something and I'm like, no, that's not it. No, that's not it. Can be done. Do it. And they were ready to kill me. But our CEO will even tell me occasionally, I'm glad that you made us do it, but we have a great sunscreen with zinc oxide, SPF 30, and it helps protect those scars from the sun exposure while still treating the scar with the silicone. It's great. And zinc oxide they use for protect the rash and all of that stuff. It's a very good product anyway on its own. So that was like the next thing. Exactly. And so the response to that, especially amongst dermatologists, was tremendous. And caveat is that any sunscreen is good sunscreen, but if you have the choice, that
the one you're going to wear.
Yes, the one you're going to wear. Yes. So that's what we had, and that's the bronze type of bottle. And we have 2 sizes of each one, because people that have like punch biopsies or a smaller scar don't need as much as somebody that a thyroid surgery with a 3-inch scar or a tummy tuck or something like that. Gives you those options.
So
when we do. Yeah, the day night is great, so that you wear the SPF during the day and the pure at night. You don't need that sunscreen. Why use a product with sunscreen if you don't need it? Because it's just taking away the concentration of silicone in the product. So let's just get all that silicone on there and at night. So the day night packs have been very popular. And then for people that have very large scars, we have twin packs of our big size as well. If somebody has widespread scar, like a big burn area or a rogue rash or things like that, where they need to cover a large area every day, that's better value for them.
Through that, because a lot of people do really think, silicone scar. patients.
Yeah.
Better be ready to answer that question. No, we admit that this is the theory. Low risk. You do not want silicone. What is prevention there? Yeah. And just a couple weeks after procedure. So about what your role. Okay. That reminds probably an apocryphal story. Classic Steve Jobs. In the first on room.
Oh, wow.
One bubble. And he said that culture can be difficult at the same time. You're laser focused on no matter how good the product is and how many went, not an experience, something.
I gave them a shopping list of products to go buy at Ulta. And I said, go buy these. They figured it out. We need to figure it out. And we can do this better with less ingredients. And we know what happened. We don't have any sunscreen boosters in it. Our ingredient list is basically zinc oxide and the solution it's suspended in is silicone. A short, dermatologists love a short ingredient list. And that was the goal, is to get that. But some people will say, well, I use it SPF 50. It should be higher. Here's the thing, is that an SPF 30 blocks 97% of the UVB rays. 50 blocks 90% of the UVB rays.
It's diminishing factor.
Yes, so you have to add a lot more sunscreen, meaning less silicone, only to get a 1% bump in that. And the other benefit of zinc oxide is broad spectrum, so you have tremendous coverage as well. It's really like that happy value product.
From the dermatologist perspective. So critical. It just for attention with a sunscreen. The product a lot of people feel that way. I thought of the product only for, and we're working on that. Not until that dinner did I just sunscreen. Yeah. Or at least try it, or try a small try, something like that. I use a mineral and one that feels great. Think outside the box and these things understand. Someone for a new sunscreen. I'm not a one product full something that I love. It's sorry.
I love the product. I use
one
that to
tube primer / sunscreen. That there's something about it, and I always something silicone. I don't know if it's it feels great going. So, time someone wants sunscreen, that going to that one, no.
Yeah.
That's great. Or do you have time to talk? Very much in my house.
Oh, yeah.
Patient looking. I always reference. Steve, we're in the mall. Go over this version. Steve Brown's going to go in his usual store environment. No offense to the guy. We dermatologists are trying. This 4.5. You go to a dermatologist there and you're trying. And yeah, put some sunscreen. But yeah, we talk about there. You're total that this is the crunchy and the scrunchy. They're going to hear things like Still's injury, liquid fruit extract, coochie opposed to a traditional
Which the natural fans will love that.
They love it. And that's about this is the mark. Speak to the mark that don't work, just because of words that they like to. But I know that most companies put a sort of gas in there, then they're going to put a bunch of other antioxidants more effective than that. They know that all
Yes.
There you go. So I spend a little bit of time talking about the new one.
We talked about the self-confidence issue with scars, and that's more like linear scars, surgical scars, trauma scars. The psychological impact of acne scars is exponentially worse than with just a regular scar. There are so many studies that they're really sad to read about what happens with somebody with acne scars, how they feel, what it makes them feel like. And even worse is there are studies that have shown pictures of people with and without acne scars and asked third-party people to say, what do you think about these people? And they were judged less competent, less all this different stuff. So we unfortunately have stigmas towards that. And no, that's not vanity. That's living. That's day to day. That's horrible, but there's suicidal risk even with bad acne scars. And so that's always, I know that from past history in marketing, doing things, Google searches, acne scars is one of the most searched scar terms. It's a big deal because people that have never had surgery, almost all of us have had acne at some point. So what can you do to help with that texture, that redness, that hyperpigmentation, depending on your skin type? If you have a darker skin type, your acne scars tend to get very brown. If you have a lighter skin type, they tend to get very red or also some brownish with them as well. And so trying to tackle all of that was the goal. Really not any products that go after acne scars specifically. If you look up acne scars, it'll be the skincare lines lightening products. Do you know what I mean? That's geared more toward pigmentation. So you'll get a little bit of this and a little bit of that, but nobody's really hedged their bets and said, we're going all in. This is an acne scar treatment. So this product has all of the ingredients are considered to be safe for acne prone skin. So there's nothing in it that would be potentially bad for people with acne. But then really, we did this with this and also our bruise products where we reverse engineered, where we said, what is the problem? You've got hyperpigmentation. What ingredients can treat hyperpigmentation? You have post-inflammatory erythema or redness. What can do that? What can help with the texture? All of these types of things. Then we dug into that. I told you I'm the geek. We dug into the clinical studies to find out not only what ingredients can help with that, but at what concentrations do they need to be. You can throw 100 great ingredients in, but if they're at a really small concentration, they're not going to do what they're purported to do. So we built this and we had a long list and we said, let's figure out a lot of them. Things like vitamin C, vitamin E, they're multitaskers. They have anti-inflammatory properties. They have skin lightening properties. They hit a couple of needs. And then we came up with our final ingredient list. And the great thing is it's great for all Fitzpatrick skin types, which means anybody from the fairest person you can imagine to the darkest you can imagine. Darker skin patients with acne scars, there are problems. And you can talk more about this. They can't do certain laser treatments. They can't do certain other ones because it doesn't. Yes, it's risky and it can make things worse. But this product work with all of them. So it starts out with 10% azelaic acid, which is very commonly used for these types of things, for these types of patients. We have bakuchiol, and I think a lot of people are aware what bakuchiol is, but it's essentially nature's retinol. It's a plant-based product that when it's studied, a lot of the activities that it has are very similar to what happens when you use a retinol product. Much less irritating, but not going to be as strong as a retin-A. It'd be more like a retinol, like an over-the-counter one, but still you're getting that benefit of those types of properties, which almost every acne patient is on some sort of retinol. We've got, like I mentioned, 2 different types of vitamin C. There's L-ascorbic acid and there's tetrahexyldecoascorbate. I know, subject to practice that one. But the cool thing, and this was something I learned, our R&D team is great, is that one of the ingredients penetrates more superficially into this and works right away, starts working immediately. The other one penetrates deeper into the skin, a little bit of a delayed action. So you've got one working immediately, and as that one's fading out, you've got this other one that's coming up to speed. So you get this really nice vitamin C coverage at a pretty high percentage. Sometimes when patients first put it on, they're like, "What? A little tingle." That's usually the vitamin C. It's a good thing. It's not, but it's
very common.
Yes, as somebody said, if it tingles, it's work. And it works. So those were there. And then a lot of, we have vitamin E as well, because vitamin E and vitamin C work in tandem together. The synergy is very overused term. With them, it's 1 + 1 = 3. They work better when they're together. Each one works better together. But the only problem is that they can be less stable ingredients. And so a lot of companies will do things like ferulic acid or something like that to stabilize. If we looked at that, what we decided to go with was something called acetylzingerone, which you mentioned. It's derived from ginger, so it's a natural-based product, and it can help stabilize those to keep them in their active form without oxidizing. But it also has some anti-inflammatory benefits and some of its own benefits. It's not just there to stabilize these two things. And then we have licorice root extract, which is used widely for hyperpigmentation specifically. And we have, obviously, it's a silicone-based product, so we know what silicone can do for scar texture. So those things, there's hexylresorcinol. There's hardly any ingredients in this product that don't function in some way that's beneficial for that acne scar. There's no water in the product, so instead we preservative. It's not we have a list where we've compared the ingredient lists of different products, similar things. And ours is like this, and all the other ones are like this. And they're all words nobody understands. That's doctors like that. They like the fact that this is all in one product, because you can buy a vitamin C product, you can buy a retinol product, you can buy azelaic acid, you can buy all these different things. If you buy all these different products, it's costing you a small fortune. And let's be honest, especially guys are not going to have this whole lineup of all these products. The doctors really like the fact that it's all in one product, where you can basically substitute for all your skincare product, because it has all the things in it that you would also be. It's got your vitamin C, so you can take a break on your vitamin C product. It's got bakuchiol, so you could take a break on your retinol product. And it can be an all-in-one. And we had a meeting recently here with all of our sales reps, and a lot of people are using it as their skincare, because an all-in-one product is great for travel because you get all of it. And a lot of people are saying, look, my dark spots are fading. I mean, it's really helping me. But at the end of the day, does it work for acne scars? And the answer is yes.
Before.
Yes. We had a clinical study. Dr. Katz in New York did a clinical study for us. And then we've also had other doctors submit before and after photos. One of our doctors in Arizona, Dr. Astelos, she had a patient featured in Modern Aesthetics magazine. It was like, what's new in my practice? And she showed it. And one of the big things too is that the doctors have been very impressed with how effective it is on the redness, because that inflammation, redness, more difficult and sometimes more harsh ingredients can make that even worse. We've had people say this might be a good thing to use for rosacea or different things like that based on the ingredient. What's your experience?
I just to talk. It has these key. They're just gravitate just here. They're alternative. Well, just one choice. So that also one product. Active ingredient. Here it works well. Whatever the price. $50, $100, whatever. I divide that. This product is $5. Got 4. There's a lot of overlap with how can I other patients as well. So this should dispense the prescription. How patients can talk to them. There's how to get this. It's really cool. More integrative practice.
A lot of dermatologists and plastic surgeons are doing injectable fillers, lip fillers, facial fillers, all of that. They're great, but they quite often result in a bruise. I'm a bruiser. If I get something injected, chances are I'm going to have a big bruise. And a lot of us maybe don't tell our husbands. So when you come home and you have a big bruise, it's really hard to deny what's been going on. So that we joke about that, but it's a real thing. So we launched a bruise product. We have an oral supplement and a topical gel. So it's at treating that bruise from the inside and outs you've got going on. And not only for injectables, that's an easy one, but things like rhinoplasty, nose jobs, the black eyes from that, liposuction, huge bruising from liposuction. You've got even like the profound treatment can cause swelling or bruising. High belly can cause. There's a lot of different things that this helps with the bruising and swelling. It's again very natural based. It's got Arnica montana in it. It has bromelain, which is derived from Arnica montana is like a yellow daisy type of plant. Bromelain is derived from pineapple, and those are the big key ingredients. But we also have grapeseed extract. Yes, grapeseed extract. You know that when after a trauma of some sort, your body's demands go up for said bruise.
So when we talk about the cold, that
so you, after a surgery or anything, we have high potency zinc, high potency vitamin C in the product. And then there's these citrus bioflavonoids that have really cool properties to them. And two of them in particular that we have in here is diosmin and hesperidin. These two ingredients are used for venous insufficiency, which that would be people who the veins in their legs are not letting they get a lot of fluid buildup in their ankles and everything because their veins are not able to pump that fluid back up to their lymph system. And I looked at that and then I did some reading and it's great, but you have to do it in a 9-to-1 ratio. It's like a very specific ratio where they worked. And when we were formulating this, I'm like, I need to be 9-to-1. And that's part of the reason why our capsules is 2 capsules, not 1, because we had to have enough diosmin in there to make it work with the hesperidin. So there have been studies with those 2 ingredients that show it can work as well as a compression stoppage or different things like that. So you're getting yes.
Yes, or to you.
Yeah.
It's good to you.
Yeah. So so in that area, it's helping to begin. A bruise is obviously caused by a blood leakage somewhere, whether a vessel's been damaged or smashed or whatever. So it helps to clear out that old blood in there that's causing the discoloration. It helps clear that faster. It helps with the swelling. It reduces the tension within the cells to help reduce that swelling. And as a byproduct of that, it's not a pain, but swelling causes pain because when you have these enlarged tissue, too much fluid pushes on the nerves, cause pain. So if you relieve the swelling, quite often it has a bonus effect as to helping with some of the pain. That we did, again, a lot of research on this, and the supplement is the only product we don't make ourselves. We're just not equipped to be an FDA supplement. We let the pros do that, but it's super successful. And I'm talking about how do you talk to the doctors about it. We go in and we say, one of you's a bruiser. Which one is a bruiser? There's always a bruiser in every office. And we say, we want you to try it. And that's usually the quickest way for them to say, oh, wow, this does make a difference. It can accelerate 7-day recovery process to like a 3-day recovery process or something like that.
That's pair that with pick your favorite. How can we accelerate the recovery process as soon? And one fight, always trying to figure out how I teach that and how I can help them. Most people would do the procedure in those homes pre-treat. There's to that speculate. They don't think in the 7 days before it, right? Or that tasting.
This one is really more doctor preference. We have a lot of plastic surgeons, especially that pre-treat. But when you think about an injectable, you're not going to get a patient to come in a week early just to get that product. Yeah. And that's just not going to work for that.
Or maybe you've had a long time thing next time.
Yeah. But a lot of the time it's after the procedure, they will a lot of them even right after it, use our topical gel and put the topical gel on and send them home the products. And they start using that. When you start taking it, then very beneficial. Anecdotal with my daughter, she had her lips done and she called me the next day and she's like, I'm so bummed out, my bottom lip. And I said, Megan, don't you arnica? Oh yeah, I do. And it in a matter of 2 to 3 days, the bruise was almost gone. In fact, good thing is that there's enough capsules in there for 7 days, use twice a day for 7 days. And a lot of the patients, especially the injectable patients, only need to use it for 3 days or so, and then they're happy with it. So they save the other half for the next go around. From a doctor's perspective, too, you are sending people out the door bruised and hurt every time. You may not be getting them back. So whatever you can do to help with the bruising and swelling is great, whether it's something very complicated like a liposuction or a rhinoplasty, blepharoplasty, the surgery, any of that. Just fillers and injections.
Be aware of these. Now on something about this on your pharmacology approach. As telling and are things. They are oftentimes it happens, just you gotta let it sunscreen. Just have a problem. That's what dermally, because it works for anti-itch, for brachioradial pruritus or dermatologic neurasthenia, to have a product like that in my pocket before because I didn't have good.
And that's one of the next step with the topical gel is we want to investigate it. Maybe you can help us. It's a terrible name, but senile purpura, which is...
And that's typed in purpura. That's
senile purpura. It's terrible, but it's basically, we all have family members that have all of the like purple marks on their arm. A lot of them are taking blood thinners. Their skin naturally thins. So
they're
the slight...
Oh
my gosh. Yes, they are. My mother she takes Flavix. She will not even wear a dress anymore. So looking at these ingredients and what it can do, there's also some emollient agents and other skin ingredients. So that's the next thing on the list is to check.
I very much practice a research destination for the desert, bad deserts.
You could probably go to the grocery store and recruiting.
Just
stuff with that.
I'd love to talk about that. I have to look at your day job, but I'm so generous to here. Of course, this was microphone that is comes about not a job. That is a job is to empower everyone else to work. Culture is like to wrap that might sum it up very far. It was very simple. To the factory. I feel like trying to take brand factory floor and just every step
where the magic happens.
Where the man to the people into the cardboard boxes to ship out and try to think. They are probably doctors. You all do a great job. All the boxes. Labels not on. Someone's tweeting. I just saw those people.
People are doing all of them stuff in the band. We couldn't do what we do if they weren't so good at what they do.
So thank you to everyone that now for in spirit of training. Of course, I am grateful to Newmedical Technology for their generous support. Of course, the product. Those are for sure. So it's grateful for you all for taking that chance. Going to bat is turning this into something more.
I'm waiting for Robin Roberts to that's a whole year and
for your time, more company, more innovations, always strips you mentioned, sheets, all kinds of different sheets, breast reductions, scarf. So if
we can do better than the Gap.
And jump in. At least for sharing for.
Thank you for caring about your patients and understanding that need that maybe perhaps unspoken that they would like to have something for their.
It's very fun. So eternally grateful for them. We'll do it again some as new things come. Dermatology podcast. Time here. Orders. So for all of the rest of it as well. Reach out for them if you want to more these products. Very generous sample program. I send this to my patients. I'll send it over to talk to patients who might be listening, doctors or practice owners. How
Sure.
If they want.
You can visit Silagen.com for more information about all the individual products. We also have a contact us form on there that whether you're a patient or a doctor, you can fill out the form and we can either get you in touch with a doctor who is carrying the product, or if you're at a physician's office, we can get a local rep come to visit you and load you up with all the samples and all the good stuff. We treat our doctors well. We give them little shopping bags, so it's a whole boutique experience because you want to have an elevated experience whenever you can. So yeah, Silagen.com contact us form is the best way to reach out to us as a patient or a doctor, and we'll get right back to you.
You are right about that. I'm in central Wisconsin. A lot of reps don't bother. Long drive, not a huge market, and small right now. 10 years, company will to nurture those. Really appreciate it. At this point in my career, reach out to in the show. Free to reach out directly. That's my personal experience. So thank you so much. Next time for podcast things. Cool.
Hey, Stephen here. If you enjoyed this episode, the best way you can support a podcast is to share, follow, subscribe, and most importantly, leave an honest review on Apple Podcast or your favorite podcast hosting platform. If you're new here, you might not feel ready to leave an honest review yet. That's totally fine. At the very least, keep listening and share it with one person in your life who you think might benefit from it. Thanks for being here. Your attention means the world to me. I'll see you on the next episode. If you like this and want to subscribe to my newsletter, head over to lewellismd.com. That's LEWELLISMD as in medical doctor.com.